Hello, everyone, and welcome to Buddha Zen Wisdom. We're here with you every day. Longevity is written on your face. You can actually tell how long a person will live just by looking at their face. People who live long lives often share 5 common facial traits. Let me tell you a story about Mr. Jones, an energetic man who's always smiling and eager to chat with his neighbors. Everyone loves him. But recently, Mrs. Parker, his longtime neighbor, noticed something strange. His usually rosy face had become pale and yellowish, almost as if a yellowish veil had been placed over it. She couldn't help but ask, "Mr. Jones, are you feeling all right? Your face looks a bit off." Mr. Jones, being his usual carefree self, dismissed her concern. "Oh, it's nothing. I probably just didn't sleep well." But as days went by, his face looked worse, and he started feeling weaker and more fatigued. One day, during a free health clinic, a doctor noticed his pallor and asked about his symptoms. After a thorough examination, the doctor suggested Mr. Jones get a full checkup at the hospital. To everyone's shock, the test revealed a serious liver problem. The liver's function had been impaired, affecting the metabolism of bilirubin, which caused his yellowish complexion. Fortunately, with treatment, Mr. Jones recovered slowly, and he remarked, "I've learned not to overlook changes in my face. It really can signal serious issues." So, let's all pay attention to what our faces are telling us. You might catch a health problem early before it becomes something life-threatening. Here are 5 facial abnormalities that could indicate underlying health issues. 1. Uneven nasolabial folds. Be cautious of stroke. The nasolabial folds, also known as smile lines, run from the sides of your nose down to the corners of your mouth. As we age, these lines become more prominent. Under normal circumstances, these folds are symmetrical on both sides of the face. However, if you notice that one side appears deeper or more pronounced than the other, this could be a warning sign of an impending stroke. When blood flow to one side of the brain is blocked, it can cause nerve damage in that area. The affected side of the face may lose muscle control, leading to a noticeable asymmetry in the nasolabial fold. In addition to asymmetry in the nasolabial folds, other common signs of a stroke include sudden weakness or numbness in one arm or side of the face, slurred speech, difficulty understanding others, blurry vision, or even sudden loss of balance and falling. If you experience any of these symptoms, don't wait. Seek immediate medical attention. The faster you get treatment for a stroke, the better your chances of recovery. 2. Excessive forehead wrinkles, a sign of cardiovascular disease. The European Heart Association once conducted a large study, tracking over 3,200 adults for 20 years. The findings showed that people who had more prominent forehead wrinkles, commonly known as worry lines or expression lines, had a significantly higher risk of dying from cardiovascular diseases compared to their peers with fewer wrinkles. Researchers speculate that the root cause could be related to collagen changes and oxidative stress, both of which contribute to arterial hardening and wrinkle formation. The small blood vessels on the forehead are particularly sensitive to plaque buildup, so an increase in forehead wrinkles could signal the early stages of vascular aging. However, it's important to note that other factors, such as prolonged sun exposure and frequent frowning or raising your eyebrows, can also contribute to forehead wrinkles. So, while an abundance of wrinkles might suggest cardiovascular risk, it's not definitive. You should also consider having professional checkups, like an ECG or heart ultrasound, to assess your heart health comprehensively. 3. Swollen eyelids, a warning of kidney disease. Have you ever woken up and noticed that your face looks puffier than usual? Sometimes, it's just from drinking too much water the night before. However, if the swelling becomes a frequent occurrence, it could be a sign of kidney problems. When the kidneys are not functioning properly, they have difficulty filtering out excess fluid from the body. This fluid can accumulate in tissues, especially in areas like the eyelids, which are more prone to swelling because the skin is thinner and more delicate. In the early stages of kidney disease, swelling may be more pronounced in the morning after lying down all night. As the condition worsens, swelling could spread throughout the body. Other signs of kidney problems include foamy urine, blood in the urine which may appear reddish, frequent nighttime urination, back pain, and high blood pressure. If you notice these symptoms, make sure to see a doctor for a full evaluation. 4. Protruding eyes, possible hyperthyroidism. Bright, expressive eyes are often seen as a symbol of good health and vitality. However, if your eyes start to protrude more than usual, this could be a symptom of hyperthyroidism. In this condition, the thyroid gland produces too much thyroid hormone, which causes the tissues behind the eyes to swell, pushing the eyeballs forward. This condition is known as exophthalmos, and it can make your eyes appear bulging or even glassy. People with hyperthyroidism may also experience other symptoms, such as excessive sweating, heart palpitations, tremors, weight loss, and an increased appetite. If you notice any of these signs, it's important to get your thyroid checked to catch any problems early and avoid complications. 5. White ring around the cornea, a sign of arteriosclerosis. Middle-aged and older individuals may notice a white or gray ring around the outer edge of their cornea. This is known as a corneal arcus or senile arcus, and while it's common in older adults, it can also indicate elevated cholesterol levels. The condition occurs when lipids accumulate at the corneal margin, creating a visible ring. Since high cholesterol is a major risk factor for arteriosclerosis, hardening of the arteries, the presence of this ring can be an early indicator of cardiovascular disease. If you notice this white ring around your eyes, it's a good idea to check your cholesterol levels and, if necessary, get a more detailed cardiovascular checkup. Signs of longevity in facial features. Just as your face can reveal early warnings of diseases, certain features are also associated with longer life expectancy. According to research by Professor Wang Hongmo, Vice President of the International Biomedical Feature Identification Society, people with the following facial traits often have a higher chance of living longer. Full forehead. In traditional Chinese medicine, the forehead is associated with the lungs and heart, and a full, rounded forehead often signals strong lung and heart functions. This indicates good circulation and sufficient oxygen supply to vital organs, key factors in living a long and healthy life. Long, drooping eyebrows. Eyebrows are known as the longevity officers in facial reading. Thick, dark, and long eyebrows that droop slightly are often seen in people who live longer. This suggests good circulation and a calm, balanced temperament, both of which contribute to overall well-being and longevity. Bright, sparkling eyes. Eyes that are clear, bright, and full of life are a sign of a strong liver in traditional medicine. Healthy eyes reflect the overall health of the body's internal organs, and vibrant eyes often mean a well-balanced and well-nourished body. Large, thick ears. In Chinese medicine, ears are connected to the kidneys. People with large, thick ears are often thought to have strong kidneys, which is linked to longevity. The kidneys play a crucial role in maintaining vitality and resistance to disease. High nose bridge with glossy nose tip. A well-defined nose bridge and a shiny nose tip are believed to indicate good digestive health, which is essential for overall well-being and longevity. A healthy digestive system efficiently transforms food into energy and nutrients, which supports long-term health. Straight, even teeth. In traditional Chinese medicine, well-aligned teeth are a sign of good bone health. Strong bones and teeth reflect a vital and resilient body, which is more likely to live longer and stay healthy as you age. Round, balanced chin. The shape and condition of the chin also play a role in longevity. A rounded, full chin typically suggests good digestive health, which is essential for maintaining energy and vitality throughout life. While not everyone will have all of these features, paying attention to the signs on your face can offer valuable insight into your health and longevity. Even if you don't have these traits, it's not too late to take action. With the right lifestyle choices, healthy habits, and preventive care, you can still promote your health and enhance your quality of life. By focusing on heart and lung health, maintaining a balanced diet, and staying active, you can keep your body and mind in the best possible shape for a long and healthy life. So take care of yourself and don't forget to check in with your reflection. It just might save your life.